Doctor,
Yes?
I was just wondering, why at my age, right, I'm 40 this year, why do I still have acne breakout?
青春嘛。
青春, right? It's a sign of youth, right?
Yes,
But it's very irritating to have like, like one acne or one pimple coming out and breakout and all. It's like, why am I still having breakout at my age?
Keith, acne is actually, as you mentioned, is a chronic, it is a relapsing, in other words, it's a recurrent inflammatory skin condition. Inflammatory means there's always swelling and infection in the skin. Okay. It's a chronic, relapsing, recurrent inflammatory skin condition that happen in actually many people. And we all know that acne and acne scars can be a psychologically crippling condition.
Yes.
Okay. Many sufferers of acne and acne scars report that they have low self-esteem. They have low self-confidence.
Yep.
Okay.
Now we know that how pimples or acne are formed. Like the next very irritating thing about having acne is the scars. But why are some people, like for example for myself, right? Why are we more prone to scarring?
Why some people are more prone to scarring? It's not completely understood. We know that there's a little bit of genetic component associated with it. Usually, if a person comes to me with acne scarring, especially teenager brought by the parents, usually one or both parents have acne scars. Okay, but some people, the parents have flawless skin, the siblings have flawless skin, but they have acne scars. Okay, we do not know why, but the important thing is that if you do have acne scars, the best thing that you can do is that when you have children next time, or you have friends with teenagers who are breaking out, advise them to see a doctor. Okay. Okay, when you have active outbreak, you should see a doctor to actually prevent the formation of acne scars.
Okay. So what happened? Okay, this is something which I usually will do, and I believe a lot of people around us will do the same thing. So when we see like one acne popping out, right, and then we will get very agitated, and then we will try to squeeze it. Yeah, I just can't help it. I just don't want to have that acne or that pimple on my face.
So you have to pop the pimple.
I have to. I have no choice.
Now, if you have acne outbreak, my advice to you is not to pop the pimple.
I can't.
Okay, because if you pop the pimple, the chances is that you might scar. Okay. So if you really see the irritating pimple coming out and you really just have to pop the pimple, there's a certain way to do it. So hopefully you don't scar. As I mentioned earlier, the best is you see a clinic or with trained therapists. For example, my clinic has trained therapists to actually do proper technique to remove black and white heads and to remove the pus. Of course, we use sterile needles, and we don't squeeze the pimple too hard. Now, if you have to pop the pimple, make sure your hands are clean. You don't squeeze too hard. Don't squeeze till there's a lot of bleeding and there's clear fluid oozing out, because when that happens, what you've done is that you squeeze really hard, you damage the skin surrounding the pimple, and once the skin is damaged, there's even more infection, more inflammation, and then that pimple is going to scar.
Because you know what, doctor, I was told by my friend, right, if we were to pop a pimple, right, I have to make sure that I have to drain out all the blood until the clear white fluid comes out.
Oh no, you're not
so
supposed to do that.
That's which means that I totally extracted all the toxins and all. So this is
because
not real.
Usually when that happens, you squeeze all the blood and the clear fluid come out, you would have done a lot of damage to the surrounding skin. So when you do that, if you are in a treatment by a doctor, you're undergoing treatment by a doctor, we give you antibiotic cover, we give you antibiotic lotion or cream, then at least you're undercover with antibiotic. If you are not, then that pimple that you pop is going to heal with scars. If you really have to do it without seeing somebody who is trained, then do it gently. Make sure there's no excess blood or excess clear fluid oozing out from the pimple.